Sawadee krap. Good afternoon once again. Wednesday, the 6th of October 2021, and this is the English language summary for the press briefing here at the Center for COVID Situation Administration, or CCSA, as always. So thank you, Dr. Samui, for the Thai language briefing for today. One of the issues that she focused on was on the community collaboration that is going on around the country. Community collaboration, meaning all sectors of society in the various provinces have put in their efforts to assist with the measures and the efforts, as well as the vaccination efforts, as well as in terms of all the facilities and everything that's needed in terms of the logistics, in terms of the measures, in terms of the cooperation that's needed around the country in various sectors. So that is very important. It's something that is ongoing in Thailand, community collaboration throughout the country. One region, one set of provinces which we are focusing on right now are the provinces in the southern border provinces of Thailand, specifically 4 southern border provinces of Thailand, where we have found that the numbers are quite of great concern. The numbers are increasing in terms of the COVID infection. Now, we have an infographic for you there. It's actually a quote from the Jula Ratchamontri, which is from the Islamic community, the leader of the Islamic community in Thailand. And the Jula Ratchamontri has mentioned about the inoculation of COVID-19 vaccines, which is something that is very necessary to have the shots. So this is out so that the Muslim community, our Muslim brothers and sisters, can be more aware that this does not go against any belief or go against any teaching of the Islamic faith. So this is a PR which has been distributed in the southern part of Thailand, that COVID-19 vaccine is very important. It's something that everyone in the country should be taking. It's very important to protect ourselves from the infection. It's the responsibility of everyone in society, no matter who you are in Thailand, so that we can help protect ourselves, we can help protect our families and our society and our country from COVID-19. So this is a very good message from the Jula Ratchamontri. So I'd just like to move to the vaccination progress, which was summarized just now by Dr. Samui. We have administered since the beginning of the national vaccine drive a total of 56.6 million doses of vaccines already. So over 56 million doses in total. Yesterday alone, in one day, we have recorded and reported today, we have recorded over 732,000 doses of vaccines administered. And you can see the breakdown of the first and second dose on screen. As for the timeline for the country's reopening plan, the CCSA has approved a four-phase timeline for the country's reopening plan to revitalize the nationwide tourism industry. And as you can see on screen, we have divided that into 4 phases: the pilot phase, the first phase, second phase, and third phase. Just to recap, that the pilot phase began in October, the 1st of October, and this includes popular tourist resorts. The first destinations to open, as you know already, since July was Phuket, then followed by Surat, Thani, Samui Island, as in July, and most recently Krabi and Phang-Nga provinces in August, and of course with the 7+7 extension arrangement from Phuket. So this phase will also see the opening up of new destinations in Krabi province, such as Khlong, Muang, and Thap, Khaek. So that's the pilot phase from the past months until October. Now for the first phase, which would we count from the 1st of November, that would be the reopening to be extended to 10 other tourist destinations and cities, including for Bangkok, Krabi, and Phang-Nga province, and designated areas in provinces such as Buri, Ram, Chiang Mai, Chonburi, including Pattaya and nearby districts, Sattahip, Loi province, Phetburi province, including Cha'am and Hua Hin, and Ranong province as well. So this will be in the first phase in November. Come December, The reopening would include and be extended to 20 more provinces which are tourism driven. And in the third phase, which is January 2022 onwards, this reopening will extend to the last 13 border provinces. So, as you know, the CCSA has asked all concerned government agencies to prepare for this phase 1, phase 2, and phase 3 reopening, of course, with the necessary measures in place. And meanwhile, foreign tourists, visitors can continue to visit these 4 pilot beach destinations under the existing conditions for this pilot phase that we have right now. So come the other months in the future, we'll have these first, second, and third phase, which follows the pilot phase. So hoping that this will help the tourism industry in Thailand, and as well as maintain the vigilance that we have in protecting against COVID infection. Now, just some updates which will be of interest to the English language audience here viewing us on social media and on television, also from abroad, is regarding the VOA, or Visa on Arrival, and of course related to the Phuket Sandbox scheme. So firstly, as you know, Visa on Arrival to Thailand for foreign tourists, that's one cluster. Another cluster is the Visa on Arrival for the Phuket Sandbox scheme. So I'll start with the first one, is the regular Visa on Arrival, the general one. So the passport holders of the following countries you see on screen and territories, countries and territories, may apply for Visa on Arrival to enter Thailand at any international airport from the 1st of October onwards. So this has begun already. These countries and territories, I won't read it out to you, you can see on screen, are in addition, it's in the yellow box you see on screen, it's in addition to the countries already in the Visa on Arrival list. And from October 1st, 2021 onwards, last Friday, this has been applicable for additional countries you see in the yellow box on screen. But of course, all the necessary documentation, COE, and all the requirements have to be fulfilled. This is just about the visa that can be applied on arrival. Now that's for the general entry into Thailand from various countries. Now the Visa on Arrival scheme for the Phuket Sandbox in particular, this is valid for 15 days and cannot be extended. You would have to ensure that you have approved COE from the Thai embassies abroad and choose the visa type of visa exemption, meaning that you'll get the visa upon arrival in Phuket. And of course, have all documents checked at the Port Health and Quarantine facility at the Phuket International Airport. In applying for the VOA, you must have, of course, the necessary documents, the passports, valid, as well as confirmed flight tickets, the confirmed hotel as per requirement, and of course the carrying the amount of cash in currency that is required, as well as the application fee and the compulsory RT-PCR COVID test upon arrival with a negative result. So this is Visa on Arrival, particularly for Phuket. So meaning that when you have the COEs from the Thai embassies abroad and you're allowed to enter, there's no need to get a visa prior to coming to Thailand, but you can get a visa coming to Phuket upon arrival in Thailand. So just two different schemes, the Visa on Arrival in general for coming into the country, and Visa on Arrival for arriving in Phuket, in the Phuket Sandbox. I'll move now to the general situation and numbers that we have for today. We have new confirmed case at 9,866 cases. We have 10,115 new recoveries. So the new recoveries is quite a little bit higher than the new confirmed case recorded for today. We have active cases still being treated, standing at 108,022. This number indeed is reduced each day because of more recoveries than new cases. We have fatalities standing at 102 fatalities. The number of fatalities, of course, is also lower than the past days and weeks. If you followed the peak of the situation in the past months, you would see that there would be around 200 or more than 200 deaths, fatalities per day. So today we're down to 100 plus for quite a few days already. So today we have 102. The fatality rate in Thailand remains at 1.04%. As I mentioned before, of course, our vaccine diplomacy, our coordination with international countries and bodies, of course, organizations continue. Our cooperation is much appreciated. I'll just recap to you 3 of these, which had already passed, been proposed to the cabinet and passed the cabinet already. The first is the goodwill and cooperation between Thailand and Germany. We, of course, appreciate the goodwill of the donation of 2,000 doses of Casirivimab, Imdevimab, or the monoclonal antibody from the government of Germany for the effective treatment of patients and reducing risks from turning into severe cases. Now, this antibody arrived on the 13th of September and officially handed over on the 4th of October, on Monday, to His Excellency Prayut Chan-o-cha, the Prime Minister of Thailand. The Prime Minister presided over the official handing over ceremony at the Government House, and Ambassador Georg Schmidt, Ambassador of Germany to Thailand, attended, and with the representatives of the German government. And you have an image there on screen. So definitely we appreciate the German government for this donation also of 346,600 doses of AstraZeneca vaccine that is expected to arrive around mid-October, very soon. The in-kind donation of medicinal products is part of Germany's humanitarian efforts to support Thailand. And of course, this warm gesture and contribution reflect the close bonds of friendship between the two countries. We'll be celebrating the 160th anniversary of relations, of diplomatic relations with Germany next year. For Thailand and Iceland, Thailand also appreciates the government of Iceland for the friendship and goodwill donation of 100,000 doses of Pfizer vaccine to Thailand, which will increase the vaccine numbers in Thailand. And the Pfizer vaccine is expected to, this is Pfizer, and it will expected to be arriving in Thailand in this month, in October as well. And this has been proposed and passed the cabinet already. So Germany and Iceland. And finally, Thailand and Hungary. The third recent cooperation is Hungary, with Hungary, the country of Hungary, on vaccines, wherein the cabinet approved the purchase of 400,000 doses of AstraZeneca from Hungary to help increase the ability of Thailand to deal with the pandemic. This cooperation, of course, based on the two countries' close and friendly relations as well. So thank you to Germany, Iceland, and Hungary. Finally, before closing, I'd just like to mention, to extend appreciation and support, of course, to all of our people, our staff around the world, our colleagues, all of the officers from the Royal Thai embassies and consulates around the world for still continuing to work tirelessly since the pandemic started in late 2019. So not only are they facilitating travelers from both Thai nationals and foreign nationals traveling into Thailand, not only that, but the Royal Thai embassies and consulates general are also protecting and rendering help to Thai nationals who remain to be living abroad until today, those who are expats today. So shown on screen some images we have of these missions that have been performed already, such as the distribution of medicine or the herbal medicine, Pha Thalai Chon, masks, alcohol gels, food, as well as providing information and medical consultation for those in need. And as I mentioned, facilitation and assistance not only to Thai nationals, but foreign nationals in applying for their COEs and coming into the country. And of course, the expat community living abroad, the Thai expat community living abroad, which number around 1.6 million. These images that you saw on screen just now included the work of Thai embassies in cities such as Manila, Chennai in India, and Madrid. So with that note, I thank you for your attention, and we'll see you again next time. Please stay healthy and continue to take care of each other. Thank you very much. สวัสดีครับ
ครับขอบพระคุณนะครับท่าน